Hello and welcome to the program. I'm your host, Neil Howard. Thank you for joining us here on Health Professional Radio for this Health Suppliers segment. Our guest in studio is the author of a brand new book, When Tumor is the Rumor and Cancer is the Answer. Welcome, Dr. Kevin Ryan, to Health Professional Radio. Thanks for joining us today, Doctor.
Thank you very much. Appreciate being here.
Great. A very intriguing topic for a book, When Tumor is the Rumor and Cancer is the Answer. Talk about the title of that book.
Well, that's precisely how it happens. Your doctor, your primary care manager, your perhaps specialist that you're seeing for whatever reason, yourself, your loved one, someone in your family, notices something's wrong. Any of the symptoms that could be tumor, and there are so many: change in bowel habits, new pain, weight loss, new areas of growth somewhere, new headaches, and I could go on, but they're new, and they're a rumor. They're a rumor that there could be tumor. And then a certain sect of those people, and that's about 1.85 million people a year, of which 600,000 will die. And 80% of us know someone with cancer one way or the other, or will know someone. The rumor is tumor,
yes,
and the answer is cancer for these people. And it is devastating, it is frightening, it is a loss of control, it is, will I die? Can I handle this? What about my family? What did I do to deserve this? And more anxiety, fear of the unknown.
And more than any other diagnosis, the patient and their families and their friends, everyone, they're devastated by just the diagnosis, let alone what's to come.
And there are studies that back that up, besides common sense and living a life and knowing your own personal feelings and sharing them with others. There's literature that backs it up. A heart attack, AIDS, the latest infectious disease from a mosquito bite in some exotic locale, none of them create the same macabre mystique that a diagnosis of malignancy conjures up. And it's because it can go anywhere. It can hit at any time. It is a equal opportunity abuser. It's a non-respecter of persons. And most people think it's the end of the road.
You say most people think that it's the end of the road. It's not necessarily.
Not at all.
But what about this anxiety? Doesn't that add to the overall outcome during this cancer journey?
Absolutely. Anxiety, as we all know, is not the same as fear. We may think it's the same as fear. The physiologic feelings are the same as fear, but give it a little more thought. Fear is when you know what the enemy is. Anxiety is when you don't know. Anxiety is fear of the unknown. And there is a solution to anxiety, whether it's your first Little League baseball game or your first speech in front of people or your first anything. It's fear of the unknown. And the way you treat it is knowledge. That's what cures it. Knowledge.
Okay, so simply learning about what you're fearful of takes away at least that part of the anxiety.
It certainly does, and having an oncologist that spends the time with the family and with the loved ones and with the patients to let them know that they're going to be heroes. In 30 years, I saw zero exceptions. No matter how many times I myself said I could never handle it, I heard patients say I could never handle it. I heard nurses say, I don't know how they handle it. I have always seen heroes. It is amazing how we are hardwired to handle the hardest things to handle. But if you think about it, people going to war, granted they may have a higher mission and a higher calling, but in the horrors of armed conflict, I don't know how they can handle it. Well, they do.
Yeah, you're right.
But they do. They do. And the same thing happens with the enemy of cancer. You see heroes. You see deeply inside the human psyche, you see the spirituality of the person, the sense of purpose, the sense of why are we here, the sense of fight. And it is really humbling to be around.
Your book, When Tumor is the Rumor and Cancer is the Answer, is this a book that's geared for the family members to help with the patient, or is it something that's geared for the patient to understand what's going on with them and thereby help those who may still have anxiety?
Both and more. It takes everyone on a journey from the very beginning, which is autonomy, and that is the sense that they are the co-captain of their ship. MD does not and should not mean magnificent demagogue. They are the co-captain of their ship, and they get there through knowledge. It helps them both. And if an oncologist is sensitive to it, and a medical student, and a resident, and a fellow in oncology, it will help them also in seeing the journey that these patients are inevitably going to go through. They're going to go through autonomy and anxiety and depression and psychosocial issues and self-talk and what do other people say to somebody who has cancer and clinical trials and future therapies, and I could go on and on. All of those are going to occur in the journey that they're about to embark on, and all of those have a lot to say about themselves. And that's what's in the book. It's a guidebook. It's a comprehensive, compassionate, and comprehensible text for these patients and their supporting staff.
Now, before you arm yourself with a book such as yours and get this knowledge, this understanding, anxiety often breeds desperation.
Absolutely.
And sometimes patients and family members are looking for some alternative methods to treating cancer. Talk about some of these alternative methods that could possibly be beneficial.
Well, the worst thing that the patient can do is one of the most common things that the patient does. They see one of the most famous doctors ever to walk the modern earth, and that's Dr. Google.
Yeah.
They have no idea what in the hell they're doing when they initially start out. None whatsoever. It's like being at one of the major ports of embarkation of Fords, and let's say there's 1,000 Ford Focuses, and I say, find mine. They can't find it. I say, find mine. It's a white one. They still can't find it. I tell them more details. They still can't find it. They need the vehicle identification number. They are individuals. Furthermore, besides being individuals, they're going to get individualized therapy. So looking to Google first is not a wise idea, but 40% of patients do it. And you would be amazed of how out of the woodwork comes Uncle Joe and Sister Sally and brother-in-law Bob and, well, you know, Kickapoo Joy Juice and anecdote, which is not antidote. And it's a bad thing. Now, that's not to say that the plant and animal kingdom has not and will not give us very potent medications, but medications studied scientifically and put through clinical trials. But absolutely, it has given us many things. But there are carny barkers and hawkers. And since the beginning of time, there's been the medicine man and the shaman, and the one saying something that's just too good to be true. You don't know the purity of the compound that you're taking. You don't even know what the active ingredient is. You don't know if it interacts with the medication that you're taking from an allopathic medicine. You frankly don't know anything about it, except you think it works. And about 13% of the time, that placebo effect kicks in.
What about when, cancer isn't necessarily the answer?
The rumor may be you think it's tumor, if that's what you mean, and it turns out that it's not cancer at all. Well, this is a great celebration. This is a cause for elation. This is a reason for the physician to give happy news and good news to the patient and to tell them that this is great. It could also mean that it's a highly, highly curable or highly, highly treatable malignancy, which a simple excision will take care of the tumor completely. It may still be a cancer, but it may be very, very slow growing and easily handled by conventional therapy.
Well, normally when there's, I guess, not the big C, as it were, you just explained it, sometimes it's something that can be treated very simply without chemo and things of that nature, without the long journey of cancer. And sometimes maybe it's something, within the tissue that's not necessarily cancer, but once you educate yourself, you're aware.
That's right. Let's make a distinction which will help you with a third part of that question, and that would be a tumor means growth. Growth does not mean cancer. Cancer is uncontrolled growth of malignant cells that don't stop dividing and don't obey the rules of the tumor area, the tissue area that they are mimicking. They're the great mimickers. A liver cell, think about this, it's magical. It's the mystery of how we're wonderfully made. A liver cell knows, okay, I've reached liverness, I'm going to stop. I'm a liver cell. But a hepatocellular carcinoma, a liver cancer cell, says no. And furthermore, I'm going to recruit various blood vessels to give me a way to get more nutrition. And furthermore, I'm going to turn off the immune system around me or impair it in some way. And I'm going to spread both locally and perhaps to a distant area. Yes. That's cancer. So tumor just means growth. It does not necessarily mean cancer, but a cancer is a tumor.
Is there a website related to your book, When Tumor is the Rumor and Cancer is the Answer?
Yes, and it's exactly the name of the book. www, no spaces, When Tumor is the Rumor and Cancer is the Answer.com.
Well, it's been a pleasure talking with you today, Dr. Ryan.
Thank you. Same here.
Great. You've been listening to Health Professional Radio. I'm your host, Neil Howard, on this Health Supplier segment with Dr. Kevin Ryan, author of When Tumor is the Rumor and Cancer is the Answer, a comprehensive text for newly diagnosed cancer patients and their families. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud.